malaria. Remember, malaria is Plasmodium falciparum. This is on our note cards too, so it's a double dip to help us remember. It's a protozoa. It's a non-modal protozoa. Remember what those look like. And how you can recognize malaria, or when we get into the lab, you'll have red blood cells, erythrocytes, and then they'll either be in here or on the slide itself. So there'll be cysts and trophozoites around red blood cells. So leading cause of death and illness in developing countries, signs of systemic infection are, so we're gonna say signs of systemic infection. So it's a good thing to think about is like systemic because it's in the blood. Systemic infection, usually the signs of that are like flu-like symptoms. So like Dr. Villegas was saying earlier was like flu-like symptoms, like what is it? Is it HIV? Is it malaria? You don't really know, you just feel like garbage, and then you have to do testing and figure out what it is. So to test for malaria is a blood smear. Then we had HIV. Don't stress about the positive single strand envelope situation yet. We'll talk about more of that during the final. And we'll talk about reverse transcriptase in the final. But know that HIV is the CD4 T cells die of secondary infection because of the low CD4 T cell count. Systemic infection, AIDS is a low T cell count, and we test that with ELISA. You can be safe to say that if it's a virus using ELISA, you can be safe. That would always be the case. So here I showed you an example of a patient with low lymphocytes right here. So they have a low T cell count, but this can also be a low B cell count in the case of mononucleosis. Affects B cells, but that was kind of a side note. Okay, so endocarditis is an infection of the endocardium of the heart. Usually it's for drug use patients. Sometimes there's a heart valve surgery or severe immunocompromised patient. And then the bacteria gets into the bloodstream, and then from the bloodstream it infects this inner lining of the heart. Signs of systemic infection. It's aureus and pyogenes are the two main ones. We can differentiate between those two with the catalase test, or we can look at those under the microscope. So then we talked about sepsis. So the two most common causes of sepsis are aureus and pyogenes. Also E. coli is something to think about. E. coli is so common mostly for older patients. So patients that get a UTI from E. coli that are elderly, it can progress to sepsis because it goes untreated.
Is E. coli the one that is in the bowel movement?
Yes.
So that's probably just bad hygiene for them, just
Yes,
as they
it's
get
bad
older.
Hygiene, yes, but also even
like wearing briefs and things like that.
Yes, and like wiping, and so teenagers will get it because of incorrect wiping, but also intercourse.
Yes.
Everyone can get it, so it's a good idea to urinate after intercourse every single time, just to get the bacteria out. Primary infection gets progressively worse, and it can be like a sudden onset of progressive septicemia, or sometimes septicemia is just anything in the bloodstream. Bacteremia is specifically bacteria in the bloodstream. It moves on to sepsis, septic shock, and multi-system organ failure. So that's it's an immune system problem. So sepsis, yes, it's caused by a bacteria originally, or sometimes it can be viral as well, but most likely bacteria. But it's an immune system problem. That's what goes wrong. So it starts with a local infection, then they found bacteria in the bloodstream. Now you have a local signs and symptoms, and then systemic signs and symptoms. So like mental confusion, it could be nausea and vomiting, it could be rapid heart rate, it could be feelings of flu-like symptoms. But then all of a sudden the blood pressure drops. And when the blood pressure drops, that's the first sign of sepsis, that your patient is having immune system dysfunction because of that vasodilation. And then organ damage because the organs aren't getting enough blood. That's called septic shock. And then the organs actually start shutting down. And so that's when it gets into multiple organ dysfunction. Yeah, really scary. It's fast. And like even for patients, you wouldn't think necessarily, but some patients are really young and some patients are, it's surprising to get sepsis. One of my ex-students just texted me and said she had sepsis. She had, I forget what she had. I think it started out as a lung infection because she had COVID, and then she had exudate in the lungs, and then it got into her bloodstream, and then she had sepsis. So yeah, I think that's what she told me the story was. But she is your guys' age, you know, she's 20 something. So it is scary. Okay, here's Lyme disease. This is from a bacteria. This is signs of systemic infection again. This bullseye rash can occur. And so that's what the bullseye rash looks like. This is what the bacteria looks like. It's not a helmet. You can tell because it's much, much smaller than a helmet. And then mononucleosis is a virus, signs of systemic infection, and it's a provirus and an oncovirus. So those are just things to review. Okay, so let's get going really quickly on respiratory. So